I know there are different kinds of music therapies that go with different kinds of impairments. Can you just explain the different therapies that are used and what they're used for?
Let me clarify, if it's okay. What we saw in this amazing video was somebody responding to music, and music reaching them at a very personal level. The word therapy really means about attending to and treating. So music therapy is about attending to and treating a person with music. So the treatment
that wasn't
isn't
that,
right.
Exactly.
But then what happened, which is amazing, is that somebody interacted with that individual. Somebody reached out to them and said, "What are you listening to? What do you like?" And that engagement starts the therapeutic process of bringing the person from listening to a piece of music to now engaging them in understanding what that music means to them. So music therapy, and the field of music therapy has been organized as a profession since the 1950s. Music therapists use music prescriptively, such as a rhythm, to help somebody with Parkinson's disease walk, or can be used to help a child learn how to speak for the first time in a developmental way. It could also be used in in-depth psychotherapy to help somebody deal with trauma or something that they can't verbalize in an interactive way with the music. So music
I have to stop you there. Explain that one.
Well, think about somebody who has a hidden fear, who can't really understand what they're afraid of, or a deep feeling that they can't bring to the surface. There's no words to describe it. And yet, if a music therapist who's trained to understand the nuances of how music affects neurophysiological function or psychological function can interact with that person with music, have them express themselves through sound, and then reflect back to them, what does that mean to them? Or have them act out some of those fears, not in a nonverbal way. And that's how we get to the therapy of music.
Okay, I interrupted you. Are there other examples that you want to tell us about?
Oh, sure. Well, Oliver touched on a few with Parkinson's for sure. One of the most dramatic things, and you saw in the Awakenings documentary, is how somebody who can't move on their own can move when a rhythm is played. Oliver, you talked about the people being able to carry that music with them now. In the past, the music, as long as the music was playing, the person was able to move. Right, so the music was almost like a prescription drug, activating motor function. But what we've learned over time is that people can self-cue themselves if they sing the song. So if somebody is able to sing a melody, they can actually cue and stimulate the same motor pathways that allow them to walk. So somebody with Parkinson's, if they could sing a rhythmic song, can actually cue themselves and allow themselves to walk. So we're learning, because of scientists like Peter, why this works. We've seen it work. We've seen it work for many, many years. It's just now we're coming to a real understanding of what are those underlying mechanisms.